Hi, my name is Greg Fell, I'm Director of Public Health for Sheffield. This is a situation report and epidemiology of the 14th of December. What a difference a week makes, I guess. So mostly I'll talk about the Omicron variant. It's definitely here, it's with us, and will increase rapidly over the next couple of weeks. It's not quite taken off in Sheffield yet, that's only a matter of time. Looking at what's happening in some parts of England, it's spreading very, very, very quickly. Much more quickly than the Delta strain, which remember spread pretty quickly, and will be the dominant strain in England by census by the end of the calendar year, at the very latest. More infectious, possibly more transmissible in the early stages, i.e. before you become symptomatic. That matters because the importance of lateral flow device testings for people without symptoms matters that bit more. And what we're seeing is big outbreaks in some parts of the country where we've got big super spreader events which just spread the Omicron strain far and wide. What is still developing is the data on the vaccine effectiveness. The sense is that having had two doses and booster is enough to protect you from serious illness. Hence the importance of getting boosters, and I shall come back onto that later. But it is never too late, and I cannot encourage you strongly enough to, if you haven't had doses 1 and 2, to get those, on the path towards being fully vaccinated as soon as you possibly can. And the data on that isn't 100% clear, but all of the science is developing in that general order. People say it's milder. I'm not sure. I don't think it's safe to plan on that basis. It's probably no more severe, i.e. an infection with Omicron is no more severe than an infection with Delta, but I don't think it's safe to say it's milder. It may be, and that would be good news if it is, but even if it is milder, a very much more transmissible virus means more numbers overall, of which some of whom will become poorly. So milder is good, and we just don't know. So it's not safe to plan on the assumption that it's milder, and we are not doing so. The impact is going to be significant. The impact on the NHS and social care system is going to be significant. The maths, if you play the maths out, it's perfectly apparent that is the case. We're taking it very, very, very seriously, and again, I can't underscore that enough. So the NHS was already in quite a difficult place, and this is going to make it worse, probably going into just after the Christmas period, is my sense. Worth me saying, the fundamentals haven't changed. It's still COVID, it's still SARS-CoV-2, it's still broadly the same virus, it's still a dangerous respiratory virus, it still causes people to be poorly. On the back of a massively high baseline, so we have still a high rate of COVID now. It's going down slowly, but that will change soon as Omicron takes off. That will go the wrong way really rather quickly. But it's still COVID. The fundamentals haven't changed. So if you have symptoms, stay at home, wear face masks, hand washing, ventilation, etc. all still matter. Clearly, we're in the run-up to Christmas. Plan B didn't preclude Christmas parties, but I would encourage you to do so as safely as you possibly can. And most importantly, if you have symptoms, please stay at home and get a PCR test. Most of the transmission remains within households here. So Plan B will be implemented subject to parliamentary assent, and that's going through the House of Parliament this afternoon. The measures within it are 3 or 4-fold. One is the work from home if you can. So office workers who can work from home should now be doing so. As I say, it's subject to parliamentary approval, but I think it will go through. Some events will be required to check that people aged 18 and over are fully vaccinated and or have proof of a negative test in the last 48 hours. That will apply to nightclubs, larger indoor seated venues, and some outdoor larger unseated venues. And full information about the changes will be at the end of the video. Second measure is wearing a face mask will become mandatory again in lots and lots of enclosed public spaces. And again, many of you are, and thank you to those of you who are. They have made a difference. No two ways about it, they've made a difference. They will not contain the spread, but they will certainly slow the spread. Lastly, boosters. The booster campaign, as you'll have seen, the Prime Minister has made the announcement that he's accelerating the offer of boosters. He's bringing the deadline or the target date forward, so the whole of the adult population will have been offered a booster jab by the end of this month. That matters because that's one of the best ways that we can protect us all from serious illness, because the science is pretty clear on that, actually. Not definitive yet, but pretty clear. So that is a big ask for the NHS, a big ask for the NHS. Some services may be paused until the end of the year to enable the NHS the operational capacity to implement that task. Please be patient with the NHS whilst they do that. They're doing so to maximise the number of lives that get saved in all of this. So please be patient. There will be some disruption in services, and I just encourage you to be patient on that one. You may need to be prepared to travel a little bit further if you can, but please do get vaccinated, because it has made a difference and it will make a difference. So but please remember, you can book a booster from 2 months after your second dose, and as I say, it's more important than ever. I've said before, I'll say it again, it's never too late to get your first and second doses if you haven't already done so, and many clinics will be extending their opening hours to meet the demand for boosters and first and second doses if you haven't already done so.